for the second webinar in the Organizational Capacity for Health Equity Action webinar series. Today is March the 20th, 2019, and I'm Sume Ndumbe-Eyoh. This particular webinar is going to focus on increasing the success of health equity change initiatives. And throughout the course of the webinar, we're going to be talking about the capacity of organizations to change, or what we refer to as organizational change capacity. I am joined on the line today by my colleague Ashley Cortete, who you'll see in the chat box, as well as our co-presenter, Samiya Abdi, who is a Senior Health Equity Specialist with Public Health Ontario. Samiya is also a member of the Learning Circle and has been involved in a lot of the conversations we'll be talking to you today about.
Hi, everyone.
Thanks for being with us, Samiya.
Thank you.
The NCCDH, who's your host for today, is located in Mi'kmahi, which is the ancestral and unceded territory of the Mi'kmaq people. And I acknowledge this land, the land which NCCDH calls home in a sense, in recognition of the ongoing relationships Mi'kmaq people have had with this land, and as a point of reflection for myself and to all of us on the line to think about how our work can either contribute to ongoing processes of colonialism or ideally disrupt them. So really thinking about the things we do in our daily practices, both in our personal lives and professionally, which can help disrupt colonial practices. The NCCDH focuses specifically on how everyday living conditions and power and privilege show up in the context of health. And we work with practitioners and organizations as well as researchers across the country to identify what works to reduce both the gap in health outcomes as well as level the social gradient. And we do so through webinars like the one you're participating in today. NCCDH is part of a network of 6 national collaborative centers, all funded by the Public Health Agency of Canada. We're all located in a different part of the country and have a very pan-Canadian mandate. As you can see on your screen, the NCCs focus on different topical areas in public health. We have NCCs focused on Aboriginal health, environmental health, healthy public policy, infectious diseases, and methods and tools. And our focus, as I mentioned earlier, is on the determinants of health. Throughout the course of today's webinar, you can participate through using the chat box. If you haven't already done so, please take a minute to introduce yourself. We'd love to know your name, where you're calling in from today, and a little bit about what brings you to today's conversation. You can also use the chat box to ask questions, comment, respond to each other, and share resources related to the topic of today's webinar with your colleagues.